Okay, I'm preparing the live stream right now. You can start it, okay?
Yeah.
Let me just check if it's streaming.
Yeah, it is.
Okay, I'm preparing the live stream right now. You can start it, okay?
Yeah.
Let me just. Wait 1 sec. Okay.
Alrighty, ready to go?
Okay.
Well, hello everyone, and welcome to our third informative event of the year. My name is Hamza, and I'm one of the vice presidents of event on the Bright Future Dentist team. I would like to welcome and thank Dr. Ranjbari for taking the time out of his busy schedule to come and speak at our webinar regarding being a dentist and, in general, the dental field. So we're going to be asking him many common questions that we believe are important to know as a pre-dental student who are making their way to dental school.
Hello, guys. My name is Pedro, and I'm the event coordinator for virtual events on the BFD team. Before we pass this stage on to our lovely guest speaker, we want to introduce our club to any new faces that are seeing this for the first time. So BFD is a pre-dental student organization that is committed to helping students on their path to dentistry, whether it's through workshops or webinars such as this one, or in-person events, or through networking and mentoring. We aim to brighten your path to becoming a dental student. As always, if you're a general member, don't forget to record your own hours. Keep a tab on the name of the event, the date, and the number of hours you attended the event. If you also post on an event on your story, you will gain hours. So every 4 posts equals 1 hour of volunteering. Keep a screenshot of the post and tag our page in the story.
Okay. Header, if you want to go to the next slide. Let's go one more. All right, and so now I'd like to give the stage to Dr. Ranjbari to introduce himself and let us know who he is and what he does. So, Doctor, if you want to take the stage. Hello?
Doctor, you're okay to talk, like, could you hear us as well?
Yeah.
Yeah, if you start talking, then the screen will go over to yours.
No. Oh, thank you very much for having me. Thank you very much for all of your. I hope that all of you going to fulfill your dreams and is going to be reaching all of the things that you like it. And I'm really happy to be with you all, and hope that this hour is going to be so useful for you. Maybe get some general tips for to be a dentist in the future. And okay, here we go. I'm at your service. Yeah.
And do you want to introduce kind of
Actually,
Hamza's internet is cutting out. Doctor, we were wondering, like, if you wanted to introduce yourself and, like, say about your background.
yes. Okay. Yeah. This is an DrRanjbari. I'm grown up in my back home Iran, and actually finished my graduation in Iran. The first of all, the general dentistry from Tehran University of Medical Sciences, which is one of the most prestigious dental school in Iran in 1992. It's this year is going to be the 30th year that I've been graduated from that's university. And then after working as a 2-3 years as a general dentist, I decided to continue my graduation in the periodontics, which is I really love this subspecialty in the field of dentistry, which the most part of that is surgery, which I really like to do that. And actually, I just graduated from the Shahid Beheshti, is another prestigious, the postgraduates in periodontics in Iran in 1999. And at that time, it's more than 6 months later than the graduation, I came to my back home, Ahvaz, the Khuzestan, the southwestern of Iran. I started to work as an assistant professor at in the Ahvaz Jandishapur University of Medical Sciences. And more than 10, 12 years that I've been working them, and at the same time I had my private practice, and also there was a very busy schedule at that time. This from the early morning to the afternoon. I was in the dental school, and after that to be in the private sections, private sector. It was a very busy time, busy schedule that we started. It's actually continued till now. And right now I'm in Canada. I'm settled in Canada in 2016, but I started to get my license in dentistry in Canada, but started in 2018. And last year in 2021, actually I got my license at the general dentistry. But because of more than 24 years, 20 years, well, the 23, 24 years that I didn't work as a general dentist. Right now, I'm just working, most of my works are the limited practice in the periodontics and implant surgery, because actually I started the implant surgery since 2000. I started in more than 22 years that I've been working in the fields of implant surgery. I'm here in Canada. I'm working in the GTA, more than, I don't know, the 12, 13 centers that I've been working in the mouth in the month, and some different part of the GTA, working limited as a general, working as a periodontal branch, and also the surgery in the offices. Most of them is my friend of mine. I'm working with them. Yeah, that's it. And also, and I'm just in 2015, I was in Aachen in Germany. Really likes to graduate from the laser in dentistry. That was a very beautiful branch of dentistry at that time. It was a hot topic. I started a fellowship on them, and yeah, every now and then I working with the laser also. Yeah, that's it. Thank you very much. Yeah.
Great. Thank you for that introduction. And so I guess now we'll start with our scheduled questions. Pedro, if you want to go to the next slide. Okay. And so for our first question, I think many people might think a dentist only focuses on, the teeth and procedures involving the teeth. But could you tell us a little bit about, what dentists do and what their scope of practice is?
Actually, I'm just watching the dentistry from a little bit wider spectrum. Let's say, when you are going to dentist, it is confined to just the tooth and teeth, and then. But you are working in the oral cavity on them. So because they are there are lots of correlation between the oral cavity and in the your body system. You should be your vision is going to be much more expanded, and not only for the tooth and the area, but because we are a dentist, you know, the dentist is a combination of the science and art. This is very important, you know. This is not a fully science. This is not a fully art. This is the combination of the art and science between them. So if you haven't actually the in type of innate of art in your body, you will find yourself is to be a better dentist. This is a role, and this is a role, and you will find it in your in time of the your learning this type of dentistry, and also when you are working as a professional dentist. Every day you will find some aspect of arts in your career, which is very exciting, especially for us. Yeah.
That was a very poetic way of describing dentistry. It was beautiful. So for our next question, I think we all know what we like about dentistry, at least some of us. And we were wondering why like you chose this career, what made you pursue this career in the first place? And what do you generally like about this field?
Actually, as I told you, that's the art aspect of this kind of career is very important. Actually, when before I be a dentist, I really love to have a designer of car, a designer of automobile, you know, and especially the internal part and the internal part of the design of automobile. So when I found that this at that time, you know, at that time we were graduated, especially in my back home in Iran. I was in the middle of the war between, you know, that was a very different history and different era at that time. So the selection of the subject that you will be like at that time, it was very difficult. You didn't have any very wide spectrum of the selection and selective areas. So the dentistry was one of that kind, which was very I really cope with them, and very similar to things that I desire to do that, you know. And actually it was the parallel of things that I really want to do. So I'm really enjoyed to select them and learn about it, and to work as a dentist for them. Yeah.
Yeah, I think that's a good answer. And so for our next question, so similar to the one before, I think it's important for pre-dental students to know some of the issues that are present in dentistry and make sure that they're able to endure these issues over their professional career. So we were wondering, what is it that you don't like about being a dentist or the dental field in general?
You know, for me, is don't be in the just only a very boring and regular every day. So I don't really like it to be working is a very similar to yesterday and the day before, you know. I'm just really like to do some innovative in my works, and also I don't I don't want it to be boring when I'm working with it, because every time that I'm working, I enjoy my career. So select some subject of dentistry for yourself. Maybe in the future we will talk about this, some subspecialty for them to be talking about them. But I think that in when you are going to dentistry, you will find that in some field of dentistry is much more exciting for yourself. So sticking on that area, and every day, really, first of all, learn the new things. Do not stop to and do every time that you have the keen to be the better, to be the best, to be the best dentist. It is the most important thing for you, which will not be boring every day. I really I'm, to be honest, I'm confess that every day that I work in my career, I never use it. Oh, this is boring for me. You know, I really love to do that for them every day. It's very important.
So not be bored at work. That's a very good tip.
Yeah.
So, okay, this question might be a bit similar to the second one that I asked, but what drew you to pursue dentistry as a career? And basically, to enhance your answer, you can also think about what other careers that you considered at the time when you were also considering dentistry.
You know, it's a good and just a difficult question with them. But I really loved it because that's the combination of art and science between them. It made me satisfying. And, you know, because I selected the surgery of them, you know, the periodontics is a type of dentistry which is related to the surgery of gum component in the mouth, and also the implant dentistry. Implant dentistry is a new era in dentistry, which is introduced in about more than 2 decades in dentistry. When I graduated from subspecialty, when I graduated from the periodontics, it was the very new era in the implant dentistry. So in my province, we were the pioneers of the implant dentistry at that time. It was very difficult because every time we started to do this procedure for people, there were tons of questions from the patients. Oh, doctor, is it cancerogenic? Is it make it infection? Is it a successful procedure? Is that every time you should be use it? Actually, take a lecture for the patient about more than the half an hour to persuade the person, oh, this is not harmful, it would be beneficial for you, it's a successful procedure. At that time, it was very hard for us. But at the next 5 years after that, because we were the pioneer in that in my back home in my province, most of the patients came to our office. Okay, because you know that the internet was a very good media for the people who were search on them, and every year the patients had tons of knowledge of implant industry. They will call me to ask me, hey doctor, what is the type of implant do you use? It's from the other country or the other country? Is that this brand is good or not? This brand, I heard that is good or not? Actually, it was right now, every day we have encountering a new question, which is, you know, because of the patient are very knowledgeable and had tons of knowledge, and them that came to us. Right now, it's very difficult to do to answering all of these type of questions, you know. But this is exciting. It's much more for me. It's not much more exciting. Yeah, it is not boring for me, you know.
Alrighty, and so I think we're all aware as pre-dental students, and similar to your answer before, that the field of dentistry is always changing and evolving. And of course, no one can be certain of the future of the field, but how do you see the dental field changing in the next 10, 20, 30 years from now?
Actually, you couldn't believe that in the next 10, 20 years, it's maybe most of the procedures maybe actually change and they're going to be evolved, because that there are lots of very cutting edge knowledge they come to the dentistry. Artificial science, some kind of navigational system which you can use it with your without watching the patient. You can do the procedure for the patient with the navigational system. And also you can find in some biomaterial engineering, we call biomaterial engineering. There's lots of material which come, for instance, in the ceramics, in the resins, in the bone material, in the implant, in the titanium, in metallurgy. In all of them is going to be a huge amount of technology came to the dentistry, especially in implant dentistry. So you cannot imagine what will going on in the next 20 years, okay? And this is very, very exciting for you. Very exciting for you to be actually because that although the technology and robots maybe in some industry can replace the humans, but in the dentistry, I don't think that the next 20 years the robots can replace the patient, the practitioners. So maybe you have the capacity of gain the science as a robot, but you will do this on the patient. So it's wonderful, I think. I'm really excited to hear about the next 10, 20 years. Yeah. At that time, I will be retired, but I will be follow up the case. Yeah. Good for you, the young generation.
I personally can't wait to deal with, like, in 20 years, all the Google questions that patients are going to ask after doing one search on Wikipedia or something. Anyways, so we know that like every single healthcare profession has its own value in the society, but what do you think makes dentistry unique from others, like a medical physician or from optometry or other healthcare professions? What makes dentistry stand out, basically?
When I compared this type of, for instance, the optometrist, the optometrist, I think the technology is very, very involved in the system of optometry and also ophthalmology. And for pharmacy, maybe it's a risky business for the graduate of the pharmacist, because there is a lots of things which is very make it very competitive for pharmacists, because some kind of companies and because of the artificial intelligence also maybe a little bit abandon the pharmacist from the being in the courier, but dentistry, I don't think so. It's every time that it's going forward, the ability of dentists is much more growing, and I'm really and owe you that's if you're choosing this career for yourself, it's a good guarantee for you, because that there is lots of technology will helping you in any other parts of the to be as a general dentist, or if you want to go to the specialty of the dentistry.
Great. Thank you for that answer. And so the next question we have is, so we know that dentists have the opportunity to specialize in a variety of disciplines, such as orthodontics, periodontics, endodontics, and more. And so given that you've practiced as a periodontist, we were wondering, why did you choose that specialty over the other specialties that you've had available to yourself?
It's a very good question. That's because actually, first of all, when I was in the D3, D4 in my in dental school, I chose that I will be at the future. I will be a periodontist. I really loved that at that time. So I had a very nice mentor. I really appreciate and I do appreciate with my mentor. Everywhere he is, I really appreciate him and make a good wish for him. He was a wonderful because it has a very nice. For me, he was a very good, actually, role model for me. I really love to be just like him in every part of his career. When he teach us and also work as a periodontist, I really love the atmosphere of his office and the attitude of that mentor. Actually, I think that when you are going to your dental school, you will find some mentors which can affect you. Maybe if my mentor was an endodontist, maybe I'm going to endodontics, okay? But when I came to periodontics, because the first of all, I really like to do the surgery, first of all, and it was the fundamental part of the dentistry. It's a very important. Just like when you are dentistry, when you are imagine the dentistry as a building, you hasn't some fundamental part of that. The fundamental part of the oral cavity is a periodontium, the periodontics. If you had a good fundamental, you have the very good building on that. Building on that, it means the prosthodontics or maybe the orthodontics and the some restorative. We are talking to my colleagues that, hey, in the building, when I every time that I'm actually passing some of our this building in the area, I found that myself that as a periodontist, as a fundamental who wants to do the infrastructure. I'm the specialist of infrastructure in the mouth and them. So I really like that. Yeah, it's a very scientific. It's a very, very scientific branch of dentistry, the periodontics, and very prestigious. In the dentistry, in the periodontics is a very prestigious part of the dentistry.
Okay, so I'm sure you'd agree that for pre-dental students, shadowing is like a very like awesome commodity. Like it's a good way to learn how a dentist works in their field. We were wondering, like, could you give us an idea how like a normal day in the office looks like for you?
Yeah, actually, because I'm working in a different offices, so I haven't actually communicate with my assistant in every day to day. I had a calendar, and I had some groups in the Telegram and the WhatsApp and the other social media with my staff in every part of the clinics. I'm just started. Usually, I'm started in 9:30 or 9:30 or 10 a.m. I'm gonna started my working, and it's gonna take time. Maybe working as maybe 5, 6, 6 and 6:30. It's gonna be actually. I'm just finishing my work. So it depends. Someday you have a busy schedule for surgery. Someday maybe in most of day you have some the patients come for consultation, and also someday there is an patient for follow-up. You have some patient for follow-up. You know, the periodontics and especially the dentistry, to be a successful dentist it is very important to follow up your cases, because you are doing some procedure for them and you should be follow up the cases. If you just only do some anything and you will be abandon the patient, most maybe some of them is going to be failed, and you don't know about the what is the outcome of your treatment. So you should be follow up your cases. So some part of our career in every day is the follow up our cases belong to the past, and also the consultation, and also the procedure. Just like for me it means that the surgery or the other things. Yeah.
And so I guess no matter how much you can research or observe, you do things, some things you just have to learn after you do something. And so after practicing dentistry for a while and being an established dentist and periodontist, what are some things you wish you knew before getting into the career?
Mm-hmm. You know, actually, there isn't working in the Canada or working in my back home was in somehow is a different story, you know, and because over here, I wished I could learn about something about, for instance, the computer science, which is more important, as you will find it in your high school, and maybe in the undergraduate you will be fine, and working with the some homework assignment and the other thing, which is you will get familiar with the computer science, which is applicable for you and maybe sufficient for you. But if you are doing some extra, for instance, you were knowing the fundamental of artificial intelligence, maybe you will actually is sparkling in your mind. That's it's maybe some you will find some branches that will be much beneficial for you in the in your career also, or maybe in the studying in the dentistry. Okay, and something I think there's the marketing. The marketing, I think, if I could learn about the marketing before, it was much more beneficial for me. And these are, I think, these are the most important issues that I've been thinking about it, before coming to the dentist.
Okay, Dr. Ranjbari, I have some good news for you and some bad news. Which one would you like to hear first?
Actually, as I told you, that's I really love to be the engineer, the first of all, yeah. And the most thing that I've been really love to do from, I don't know, more than 40 years ago, to be automobile designer. You can and right now I'm just really love this passion more than 40 years, especially over here. That's become that I more than in my especially when I'm in the resting time, I really love to watching the YouTube, and especially about the comparing the cars and the reviews of the I mean, maybe someday I'm just watching with Ali Rizal about the review the cars. Yeah, but I mean,
I don't think you understood my question. I asked, so I have a good news for you and a bad news for you. Which one would you like to hear first?
Good news. I really didn't get the point for them.
Okay, so the good news is this is the last question that I'm gonna ask you
Oh.
with me and Hamza. The bad news is you're gonna have to answer Q&A questions after this.
Whoa.
Okay,
Okay.
so for the last question, so do you have any advice or words of wisdom for a student who may be considering a career as a dentist?
The most important thing for you is to take a shadow, okay? Shadow in one, maybe in one clinic or the other different clinics, especially if you're find out what is the maybe a special in a special dentistry. If you find some different types and different branches of dentistry, because we have over 10, 12 specialty in dentistry. Some of them maybe you really likes to do that. For instance, if you are going to the offices which do the general dentistry, in some of them is do this every day, maybe just the filling that or restorative, or to the other thing which is similar to them. But when you are going to the periodontist is a totally different, because there is an management of the child, which is a different type of dentistry. When you are going to the, for instance, to the oral and maxillofacial surgeon, there's a different types of treatments, and the orthodontics as well, and the endodontics, the others. I think this, the first of all, it should be better to be at shadow. And the shadowing, I think it's make a better vision to you to for your future. And also maybe some of our clinics is just a very high discipline, and maybe do this very multidisciplinary works. I did it when I was at dental. When I was a dental student, it was very informative for me to shadow the dentist clinics. Yeah.
Yeah, I think shadowing is definitely a great tip to give pre-dental students. Yeah, and I think all the answers that you gave to our questions were, really great, and I think those are really common questions that a lot of pre-dental students have. And I know those answers are going to be helpful for students in their dental applications and interviews that are going to be coming up. So thank you, Dr. Ranjbari, for sharing your wisdom with us tonight.
Thank you very much for having me tonight. And it was been very delighted to be here with you all.
Yes. Thank you very much, Dr. Ranjbari, for being here. We're very honored. And as I pre-warned you, we are going to have a Q&A session right now. And so we're going to open the floor up, and anyone in this Zoom can now ask whatever question you guys have towards Dr. Ranjbari. So let's get it started.
Yeah, my question, what do you choose between? Right now, I'm actually right now I'm just if I had a time to actually select them, I'm just going to the car design, because it's a new era for me and to be a new experience for me. Yeah, why not? It's a very good time. But if I wanted to, but if they ask me in the dentistry, what specialty do you like to choose again if you have a time to do? No, I'm just going to the periodontics again. Yeah.
I hope one day I'll get to come in your office, but I'm really hoping, since you like cars, your like chair looks like a car. Those like that would be cool. Or for
The
like the
bucket
kids.
seat, yeah, the bucket seat, yeah.
Yeah. Rasin has a question.
Yeah, thank you, Dr. Ranjbari, for your all good advices and wisdoms. I have one question. How much time do you put like in your week for be up to date about like dental field, new techniques, new methods or treatments? How do you manage to be up to date all of the time?
It's a good question. Actually, when you are graduating from, especially when you are graduate from a specialty, uh, when you are going to for instance, if you are going to some congress, an annual congress or a scientific congress, this is a role that's maybe you 90%, 95% of that subjects we're familiar with you, but you will find some maybe 2, 3, 5% of a new innovative, in some part of that, which is maybe useful for you, because we are working, this is an experience. And I just want to tell you that's the most important thing in your profession is detail. Detail is more and the most important thing. When you are going to some congress, when you are going to some lectures, you will find some new details that they will find in them, so you can grab it. Okay, so when you will find that this detail is going to be applicable for yourself, oh, such a beautiful mind of this practitioner, it did some very good detail on their procedures, you will grab it on that areas. Last 2 weeks I was in Spain for for the course of actually there was a very advanced course in implant dentistry and for the growth factor, which was in the in the Basque province. The city was Vitoria. The founder of that kind of implant and type of implant and the science of we call it PRGF, something which is about the growth factor, which is very, this is a very hot topic in our dentistry. He actually he was a guy that with 7 years old. He was an oral surgeon, and he was enthusiastic. He was he was a wonderful man. I really found that in that Congress that maybe 10, 12 tips in that Congress was very useful for me. Most of them I get familiar with. I did use it every day at that techniques, but these type of techniques, when you are accumulate in the 5, 10, 15, 20 years, it makes you a very experienced man on them. Okay. So it is not important every day you will find some, and actually your books. Right now you needed to have some journals. These journals are the most innovative things that which publish in some scientific journals. You will maybe everything about it. Maybe I told you that 2, 3, 5% is sufficient for you to gain from the this seminars, webinars, or the others. Thank you.
Perfect. Thank you.
Okay, welcome.
Okay, Shar, so you can ask.
Hello, Dr. Ranjbari. My name is Shahrzad, and I have a question that actually the applications ask us. The question is about artificial intelligence. The Western University asks that how artificial intelligence can improve dentistry. And I'm asking this from you, that from your perspective, how do you think artificial intelligence can help periodontistry?
Very good question. Actually, the artificial intelligence can use in some technologies. For instance, if you are using some type of lasers, some type of lasers, when you are for searching a cavity in the teeth, they can process the data from the some type of the tooth, which can gather and process them. Okay, so it will find that, okay, yes, maybe you are find some for instance, the decades and the decade that you will not be watching with your eyes. Okay, that the system will find it for you. And also maybe in artificial intelligence, one of the very simple and most applicable things is for your marketing. Okay, in your marketing, for instance, if you are sending your stuffs, for instance, your products to the other medias, just like you can you will find that, okay, yeah, I'm have these abilities in some part of the dentistry, I can offer them to you. For instance, my ability to do this, some part of dentistry and part of this periodontics, the surgery, the implant dentistry, and them. And if they can this kind of artificial intelligence, just like in the Google, when you're every time that you're going to Google, the tomorrow of that, it's every time you search and in the Google, it's in some part of your computer, they can find out, okay, do you like this ice cream? Do you like this cell phone? Do you like this type of the other thing? This they can actually, you will find, every time you will talking, I think that every time that you are talking in cell phones, they can find out and they will be compile them and just to process them. So you can find it, for instance, in the artificial intelligence, if you are be a smart man or the smart woman, you will find some processing data that you can find your customers, your patients with that one, and you can advertise your thing. Yeah, I think there's lots of everything that's in technology and advertisement. The other things, it can be applicable for you.
Yeah, of course. I agree. Even if I feel pain in my teeth, tomorrow the Google brings up an advertisement of your office for me.
Yeah.
So
yes.
And I have another question, actually. I don't know if we have time, guys. Just you can help me.
Actually, yeah, go ahead.
Pedro. Okay.
Well, I was gonna give Sina a chance. Okay, go.
Okay, it's short, actually. Do you think in CBCT, the CT scans, is there anything that it's not like it's not evident and you cannot see it even in CBCTs that artificial intelligence can track?
Why not? Yeah. Actually, because it depends on the artificial intelligence. It depends on the data which you are doing to this computer and what you want to do to process and compile them. Okay, so when you are for me, when I do actually to watching the CBCT, I'm just searching for my implant industry. Okay, how much is the height of bone available? How much is the height? That one can be the width or the other things which is belong to the implants. maybe I missed that in some part of the CBCT, maybe there is some lesion on them. Okay, and the artificial intelligence on them is going to be alarmed that, hey, this is not a very usual part of the normal CT scan over here. Maybe they can find that if the data of this artificial intelligence is much more sophisticated, maybe they can find and making a differential diagnosis. Oh yeah, you will be finding some lesions, some tumor or cyst or the other thing. Or maybe it's not sophisticated, very simple that, oh, it is not normal. You can just alarm of that. Yes, it would be possible for them, and yeah, it's applicable for the artificial intelligence.
Thank you so much, Doctor.
Thank you very much. Okay.
Okay, since Sina doesn't have a question, we'll go to Crystal. No, just
Yeah, I just have a really quick question. I just really want to
no,
know.
Crystal, I'm joking. It's Sina's turn.
Oh my god.
Sina,
You
go
go
ahead.
now though. It's okay.
Yeah.
Okay. Yeah, I just want to know, Dr. Ranjbari, how did you find out that dentistry was like what you wanted to do for the rest of your life? And I know that doing one career for the rest of your life I think it's a hard decision. So I know in life it's not always linear. There are times when we want to do a different career at some point in our life. So how did you know that maybe this is something I want to do until I retire? And what characteristics do you have to have in you if you want to become a great dentist? Yeah.
Was very different and very difficult question. You know, I just if I get a point, it's very good from you. It's that you know, when I started to be as a dental student, you know, the one of the primitive thing that we were encounter with that we should make a tooth and carve the tooth from the chalk. Okay, the first time that I've been really going to the pre-clinic in the dentistry. The time that's before them, I think that I'm a very disabled man. I cannot do anything. But after the carving the tooth in the chalk and make a tooth from that, it was a wonderful time for me. That's actually it was made me make my self-esteem is going to the top of my desire. It was wonderful for me because it made me flourishing for me, you know. So every time that I've been used some very difficult type of surgery, for instance, I have 3 phases in my surgery, which was very difficult when I started. I know that this type of surgery is difficult. When I started, when I wanted to start it, yeah, I can do it. When I started at the 1/3 of that one, which is past them, I'm gonna go to the very difficult part of that. I'm talking to myself, that's, hey, are you crazy? Or what are you doing this type of surgery? You know, but at the middle of them, when these going passing them and maybe going to be resolved them, at the end of that, it made me satisfied. Say, okay, yeah, I will do it again. I will do it again. Every time that is very enjoyable for me. It is what it is that I've been resuming my career every time. So I didn't want it to be do just a very repetitive works. I do really likes to a new this is not every day you can use it, because every time that you wanted to actually made money for yourself, it would be better to do a regular works time to time, do it and do it and do it. When you are do it more, you're expert and do it. Okay. So when you are making money for everything, you should be very expert to do this. But it is not in every day you use it the same thing, just like in the Charlie Chaplin in the, you know, that one did that area. It is maybe boring for me if I did it just like in the same procedure, the same that I don't really like it. I really love to do that every time to time. I do some difficult part, which is challenging for me because I love challenge. I love challenge for that. Okay, and this is for especially the surgery for me is a very good challenge because every person is a different case with the others. Some of them had a really different types of systemic disease, which you were managing the patient is much more difficult. Or when you are coming to Canada, persuading the person to do the surgery or the procedure it is maybe some difficult one because when I'm in my back home, Iran, I was a very like the most famous and was the very experienced and in my back home in my city, so every patient that come to me 100% trusted to me. Okay, everything was resolved on that time. But when I came here, I started from scratch, from zero. So every time that I should start it with my white hair, and actually this is at that time, after the 28, 27 years that I've been started again, I started from scratch. So every time and every day I should talking to person, everything that is the very important is to persuading the patient that's to come and to made them trust to me to sitting on my chair. That's I wanted to do that for them. It's a very for starting it was very difficult, but right now it's a little bit more easier for me. That if I got your answer, I don't know. Yeah.
Thank you so much, Doctor.
Okay, we saved the best question for last. Sina, take it away.
Yeah, thank you for letting me to ask my question. Dr. Ranjbari, first of all, I just wanted to thank you on behalf of all of the participants of this session for your valuable time. My question, actually, initially, I wanted to ask the question that Shahzad asked a few minutes ago, but now that she presented her this question the best way she could, I'm gonna pass that question and ask the other one that I had. So this one is about I mean it's specifically about periodontics. What kind of like personal traits and characteristics would be necessary for a periodontist to have? In other words, what would make a very good periodontist when they graduate from their university that will be the most helpful to them? Thank you so much.
Good question, because that you know, first of all, you should to be a good student for reading the subjects and should be a talented. Not mean you are a talented person. For this, generally speaking, you know, because you know there is a difficult subject. You should have the theoretically you should be reinforce yourself with the good backbone of the getting the knowledge from that, because there is a lots of basic things in periodontics, for instance, from histology, from immunology, from microbiology, from the anatomy, from the most of them is very actually about the basic science in the medicine. You know, you should be have a good knowledge from them, the first of all. And when you're going to clinic or the clinical part, you you should be, if you wanted to be a good periodontist, you should have a good manual dexterity and working and working and working hard and hard and hard. If you wanted to be the top of them, if you will be a regular one, it's not very important. But if you wanted to be the, for instance, one of a kind, you should be actually more than 10 years. It should be working hard and enthusiastically, without doubt. And you should be after the graduating from post-graduating from school, dental school, you should have passing some advanced courses in all of parts. For instance, if you want to be a good doctor to have a very good documentation, you should go into another photography, for instance. Okay, if you want to if you wanted to present your cases, you should have a good yourself. You should have a very good presenter, just like to making a good presentation of working with a computer, or you have a very good organization, you know. So if you are, for instance, if you are if you want to go the very good detail of them, you should have a very good instrument of them. Instrument in dentistry is very important. So you needed to have a very sophisticated instrument, not from scratch. It should be gradually you can make it. If you are a perfectionist, and if you want to be a perfectionist, needed to have the best of the best of everything. You don't want it to be say, oh, I'm a number one, but you should doing just like to be a number one of that. Okay, so it depends. I think it's more than 10-15 years needed to be. It is difficult. It is totally, all of them is difficult. It's not simple, but it's feasible, but it's doable. It needs you be concentrated on your mind, on your profession, goal oriented, and be so enthusiastic about it. If you do it, all of them with you, you can fulfill your mission in the next 10-15 minutes. You cannot do it by a blink of time. You know, this is not, it is impossible. It is gradually you came better. You do the experience. Everything is belong to your hands and experience and your knowledge. Okay, and to be a very good team with yourself, very good team. Today is a good teamwork with that. You needed to have a good teamwork. If you are a good coordinator, if you are a good manager, if you are a good owner of the system, and if you coordinate all the things together with a good one, you will be good. You will actually, just like in car, you will be the Porsche. You know, you can do the Porsche or the other brands. Yeah.
Thank you very much for your thorough explanation.
Okay, you're welcome. You're welcome, Sino.
Okay, well, I think that's all the time we have for tonight. I want to thank you, Dr. Ranjbari, once more for those lovely answers, artistic answers, if you will. And if anyone else has any questions, you know, you can reach us on Discord and our Instagram page. And thank you everyone for coming, especially Dr. Ranjbari. I'm just gonna say it as much as I can because we can't thank you enough. And yeah, thank you for making the time in your busy schedule.
Thank you
Bye
very
bye.
much. Thank you very much for having me this time, and really enjoyed it. And I'm really like to the backstage of yours. I don't know, this the Bob. Yeah,
SpongeBob here.
SpongeBob, yeah.
Yeah, that's Gary. That's my actual room.
Yeah.
You might like cars. I like SpongeBob.
Yeah.
He's Patrick's neighbor.
Yeah.
Exactly.
Okay. Have a great time and take care. And actually, I'm just wishing you a wonderful future for yourself.